and cosmetic result. So Jonathan has obviously an ingrown toenail, it's quite infected and lots of granulation tissue. There's no amount of chiropody that's going to sort this out, so he'll need surgical excision of a wedge from both sides of the nail, and then we'll do an ablation of the nail bed on either side with radiosurgery to try and ensure that the nail doesn't grow back. So the ring block anesthesia is in now. We're just going to create a bloodless field because we don't want too much blood getting in the way. So the easiest way to do that is use a tourniquet and a bit of gauze, and we just wrap the tourniquet on. This is exactly the same preparation we would do if we were doing a phenol ablation of the nail bed, but we're going to use radiosurgery instead of phenol. The advantage of that is that it's much quicker. It only takes about 30 seconds to do it. With radiosurgery, it can take 3 or 4 minutes. With phenol, there's much less bleeding and much less pain post-operatively, and you're more precise in the area that you're destroying of the germinal matrix or the nail bed. Sorry. So you put on the tourniquet and then you unravel it. And that should create a nice bloodless field. Can you feel anything, Jonathan?
No.
So the toe has gone white, so it means that there's very little blood now, it's emptied out. And now we can just clean it up a little bit and just cut the nail a quarter on each side, and then a nail chisel just to finish it off, right down to the base where you can feel a bit of a give when you get right down to the bottom. That's it. Then you just take the nail out. On this side you grab it with an archy forceps the whole way down, clamp it and just twist it out like you're opening a tin of sardines. You have to make sure you get the whole lot of the nail out. That's it. You can see there was a lot of it stuck underneath. So that's all of that there is what we've removed. And there's a bit of feathering at the edge, which means that we've got the whole lot of the nail edge. That feathering edge is a good indicator that you've removed all of the nail that's ingrown. This is the radiosurgery probe, and it's coated with Teflon on this side so that it's inactive on that side, and then on the coppery side it's active. So we're going to put the active side down towards the phalanx. So it means we're going to burn and destroy everything below that, but above it, at the roof of the periungual skin, it's not going to be destroyed. So we usually need to dampen the tissues, like all radiosurgery. It works better if the tissue is a bit damp. So clean out the blood. The settings vary from machine to machine, and depending on your office, we've found that we've had to, normally it would be hemostasis at about 5 or 6, a power of 5 or 6, and you'd coagulate for about 5 or 6 seconds, and you'd leave it for 15 seconds and you do it again. In our machine we've had to go up to cut and coag to get more power. We put it to 5, and we're just going to put the probe in and just do it for 5 seconds. You normally hear a little bit of cracking. Sometimes you get a bit of smoke. So you want to lift it a little bit. Yeah. So that's it. That's it. Dress it up then with a bit of Bactrograss and lots of gauze, and the patient has to keep the foot up for the rest of today. So Jonathan had bilateral wedge resection and radiosurgery ablation to both sides of this ingrown toenail 6 weeks ago, and now you can see that it's healing up very well. It oozed for the first few weeks, and now it's dried up into a crust. You can see the small nail in the middle, and the 2 wedges on the outside shouldn't grow back. The cosmetic results usually look a lot better than this, but it would take 3 or 6 months for it to fully heal up, and he'll end up with having just a small nail in the middle. But the advantage is that the relapse rate is less than 5 or 10% of them will become ingrown again, because this is permanently removing the nail on both sides where the